Daily hospitalization rates are also increasing dramatically in younger age groups.
Let's run through some of the numbers here from the Michigan Health and Hospital Association. From March 1st to the 23rd, hospitalizations rose by more than 600% in people aged 30 to 39 and by 800% in people aged 40 to 49. By comparison, hospitalizations in those age 80 and up increased by just 37%.
For some perspective on what all this means, we turn to our Dr. Frank McGeorge. And what do you make of these trends, Doc?
Well, you know, Kim and Jason, the difference in hospitalizations among younger groups compared to older is really good evidence that the vaccine, so far, of course, mostly given to older people in Michigan, is actually having a protective effect. The problem is the increase in cases that we're seeing in Michigan, frankly, appears to be outpacing our vaccination efforts, especially when we look at recent trends.
The state's numbers for percent positivity in new cases began a distinct rise at the end of February. It can be hard to judge the trajectory at the start of a bump without more time, but 3 weeks later, it is clear we have crossed several concerning thresholds. Percent positivity is now over 8%. New cases are double what they were 3 weeks ago. We have essentially erased 5 weeks of improvement in only 4 weeks. On top of that, hospitalizations are clearly trending upward. Now, there is an important nuance to hospitalizations seen in this graph from the MHA. There has been a much lower rate of increase in hospitalizations in the age groups who have been vaccinated. Very strong evidence of the positive effect the vaccine is having.
Now, of course, this does not mean that older adults are out of the woods. As infection rates climb, so does the risk of exposure, and the more exposures, whether someone is vaccinated or not, the more chances a person has of being infected. And I also want to point out that although the percentage rise in hospitalizations are in younger groups, that is a very relative term. In this case, younger is between 30 and 50, where there is still, frankly, an important risk of complications and death.
So, Doc, practically speaking, how concerning is this, and what do we all need to do about it?
Well, you know, Kim, the rise in cases is very concerning. So far, of course, deaths haven't increased meaningfully, but of course, that lags cases and hospitalizations by weeks. Practically speaking, everyone needs to keep up precautions and really, I would say, be more careful knowing that there is this increased transmission and, frankly, get vaccinated as soon as you can.
Yeah, we're not out of the woods just yet. Okay, Frank, thank you so much.